We're going to have the drugs done by Oliver.
Good afternoon, class. I am nursing student Oliver, and I'll be presenting the drugs for Mr. CW and the interpretation of the drugs. Mr. CW was a very ill man. He was diagnosed with numerous ailments during his stay in intensive care unit. Diagnosed with type 2 respiratory failure, hospital-acquired pneumonia, end-stage renal disease, anoxic brain injury, fluid overload, seizure, community-acquired pneumonia. He was placed on many medication, but today I will be focusing on few of the drugs prescribed for him during his stay in intensive care unit. He was placed on hydralazine or Bidil, 10 milligram intravenous when needed. Now, this drug is prescribed to treat moderate to severe hypertension with a diuretic. It is classified as an antihypertensive drug and pharmacologically a vasodilator. The actions are direct acting peripheral arteriolar vasodilator. This drug lowers blood pressure in hypertensive patients and decreases afterload in patients with heart failure. The side effects are dizziness, headache, tachycardia, rash, nausea, sodium retention. Nursing implication includes monitoring of blood pressure and pulse. Frequently monitor labs like CBC, electrolytes. Specific instructions were given to nurses who administer these drugs to Mr. CW. They were to give only for a systolic blood pressure equal to 180 millimeters of mercury or greater, and a diastolic blood pressure equal to 110 millimeters of mercury or greater, and hold this medication if his pulse is less than 60 beats per minute. Also, the nurses were not to exceed 300 milligrams within 24 hours. He was also placed on amantadine or Symetrol, 100 milligrams per oral twice daily, prescribed to treat and prevent respiratory infection caused by influenza A virus. Side effects of these drugs are bladder pain, bloody or cloudy urine, blurred vision, frequent urge to urinate, and swelling of the hand and feet. Nursing implications include monitoring labs for any abnormalities and inspection of extremities. Next, amiodarone or Codarone, 200 milligrams per oral once a day. Classification: antiarrhythmic. Action: block certain electrical signals in the heart that cause an irregular heartbeat. Side effects: nausea, vomiting, loss of appetite. Next, Valsicol, Valsartan, or Diovan, 160 milligrams per oral once a day. Classification: antihypertensive, angiotensin receptor blocker, or ARB. This drug relaxes blood vessels so that blood can flow easily, used to treat hypertension and congestive heart failure. Side effects: headache, impotence, abdominal pain, and cough. Next drug, gabapentin or Neurontin 300 milligrams 3 times a day. Classification are anti-seizure or nerve pain. Action of this drug, it binds to specific site called alpha-2 delta site on calcium channels. Side effects are ataxia, dizziness, fatigue, peripheral edema, blurred vision. Next, Isodil or Imadil, 10 milligrams per oral 3 times a day.